For 20 years he had worked at the same hospital. Everyone called him Uncle Henry. Kind, helpful, always smiling. That night, when the young surgeon noticed his advice during surgery was at medical school level, she was shocked, and when she asked where he learned this knowledge, Welcome to Human Stories. Before we begin this powerful story of hidden expertise, quiet service, and the healing that happens beyond medicine, tell us in the comments which city you're watching from today, and if you believe stories like this need to be heard, hit that subscribe button and help us keep these stories alive. St. Mary's Medical Center in downtown Chicago had been Henry Washington's second home for 20 years. The large urban hospital served one of the city's most challenging neighborhoods, treating everything from routine emergencies to complex trauma cases that smaller hospitals couldn't handle. Henry Washington, 62 years old, tall and lean with graying temples and gentle eyes behind wire-rimmed glasses, worked the night shift as a hospital attendant. His official duties included cleaning, restocking supplies, and general maintenance. But anyone who worked at St. Mary's knew Henry did much more than his job description required. He arrived every evening at 10 p.m. and worked until 6 a.m., moving quietly through the hospital's corridors with a calm efficiency that made him nearly invisible to most visitors, but indispensable to the medical staff. Doctors and nurses had come to rely on Henry not just for maintaining the facility, but for the dozens of small ways he made their difficult jobs easier. Uncle Henry, as nearly everyone called him, had an uncanny ability to anticipate needs before they were expressed. He appeared with fresh coffee when the surgical team faced a long night, restocked supply cabinets before they ran empty, and somehow always knew which departments needed extra attention during busy periods. But Henry's most remarkable quality wasn't his work ethic or reliability, it was his presence around patients. Despite not being medical personnel, Henry had a gift for comforting frightened patients, calming agitated family members, and providing the kind of human connection that often mattered as much as medical treatment. Mr. Washington always knows just what to say, nurses would tell each other. Patients relax when he's around. What they didn't know was that Henry's calm presence and intuitive understanding of medical situations came from experience that had nothing to do with custodial work. The emergency department at St. Mary's was rarely quiet, but some nights tested even the most experienced medical staff. This particular Tuesday evening brought a steady stream of serious cases, a multi-car accident, several assault victims, and a construction worker who'd fallen from scaffolding. Dr. Sarah Chen, a second-year surgery resident, was approaching her 14th hour on duty when the most challenging case of the night arrived, a young man with multiple trauma injuries from a motorcycle accident. The patient needed immediate surgery, but the attending surgeon was dealing with another emergency. Dr. Chen, you're up, the charge nurse announced. OR3 is ready. Sarah felt the familiar combination of adrenaline and anxiety that accompanied major surgery. She was competent and well-trained, but complex trauma cases still made her nervous. As she scrubbed in, she noticed Henry Washington preparing the operating room with his usual quiet efficiency. Evening, Dr. Chen, Henry said in his characteristically calm voice. Looks like a challenging case tonight. Motorcycle versus semi-truck. Sarah replied, trying to keep her voice steady. Multiple internal injuries, possible spleen damage, definitely some broken ribs. Henry nodded thoughtfully. Those are tough. Takes patience and a systematic approach. Sarah was struck by Henry's comment. Most hospital attendants would offer generic encouragement or avoid discussing medical cases. Entirely, Henry spoke as if he understood the clinical challenges involved. The surgery began routinely. But as Sarah opened the patient's abdomen, she discovered the injuries were more complex than the imaging had revealed. The spleen was severely damaged, but there was also internal bleeding from a source she couldn't immediately identify. Bleeding's coming from somewhere else, she muttered, working to control the hemorrhage while searching for its source. From his position near the supply cart, Henry spoke quietly. Dr. Chen, check the splenic artery. With this injury pattern, you might have a small tear that's not immediately visible. Sarah glanced up, surprised. Henry's suggestion was medically sophisticated, exactly the kind of guidance she might expect from an attending physician, not a hospital attendant. Following Henry's advice, she found the arterial tear he'd predicted. You're right, small laceration, but it's the source of the bleeding. As Sarah worked to repair the damage, Henry continued offering subtle guidance. Take your time with that suture. Better to be deliberate than quick with arterial work. And later, you might want to check for additional bleeding before you close. Sometimes there are multiple injury sites with this kind of trauma. Each suggestion was medically accurate and clinically valuable. Sarah found herself relying on Henry's quiet guidance as much as her own training. When the surgery was successfully completed 3 hours later, Sarah couldn't shake her curiosity about Henry's unusual expertise. After completing her surgical notes, Sarah found Henry in the break room, quietly drinking coffee and reading what appeared to be a medical journal. The sight of a hospital attendant studying advanced medical literature struck her as unusual. "Henry, can I ask you something?" "Of course, Dr. Chen, how can I help you?" "Tonight, during the surgery, your suggestions were incredibly helpful and accurate. Where did you learn so much about trauma surgery?" Henry set down his coffee and looked at Sarah thoughtfully. "You did excellent work tonight. That was a challenging case." "Thank you, but that doesn't answer my question. Your knowledge of surgical procedures. It's not what I'd expect from someone in your position." Henry was quiet for a long moment. "I've been around hospitals for a long time. You picked things up." Sarah sensed there was more to the story. "Henry, those weren't casual observations. You guided me through a complex arterial repair. That's advanced surgical knowledge." "Dr. Chen, why is this important to you?" "Because if there are people in this hospital with medical expertise that could help patients, I want to know about it. That surgery went better because of your help. I want to understand how." Henry studied the young surgeon carefully. Sarah seemed genuinely motivated by the desire to provide better patient care, not just curiosity about his background. "Walk with me," Henry said finally. Henry led Sarah to a quiet corner of the hospital's chapel, a small interfaith space that remained peaceful even during the busiest nights. They sat in the back row, surrounded by the soft lighting and silence. That made the chapel a refuge for stressed medical staff. "Corpsman, Henry Washington, United States Navy," Henry said quietly. "Fleet Marine Force, attached to Marine units. 22 years of service, retired 2003. Sarah felt a chill of recognition. Navy Corpsmen were legendary in military medicine, the medics who provided battlefield medical care to Marines, often under fire, with limited resources and no backup. "You were a combat medic." "Hospital corpsman, technically, but yes, I provided medical care in combat situations. Vietnam, Grenada, Panama, and finally Iraq." Everything clicked into place for Sarah. Henry's calm under pressure. His sophisticated medical knowledge, his ability to work efficiently in chaotic situations, it all made sense now. That's why you know trauma surgery so well. When you're treating gunshot wounds and blast injuries in the field, you learn trauma medicine fast. No OR, no attending physician, no backup equipment. Just your training, your supplies, and whatever skills you can develop. Henry explained that Navy Corpsmen received intensive medical training equivalent to civilian paramedics, but their battlefield experience often exceeded what most civilian medical personnel ever encountered. In combat, you see trauma cases that most emergency rooms never deal with: complex injuries, multiple casualties, situations where you have to make critical medical decisions with no time to consult anyone. "Why didn't you become a doctor or physician assistant after your military service? With your experience and knowledge, Henry's expression grew thoughtful. "I considered it. Had the GI Bill benefits, could have gone to medical school. But after 22 years of high-stress medical situations, I wanted something different." Sarah found herself fascinated by Henry's transition from military medicine to hospital maintenance work. "I don't understand. You had advanced medical skills, extensive experience, opportunities for further education. Why choose custodial work?" Henry smiled gently. "Dr. Chen, what do you think is the most stressful part of being a doctor?" Sarah considered the question. "The responsibility, I guess. Making life or death decisions. The pressure of knowing that mistakes can kill people." "Exactly. For 22 years, I made those decisions under the worst possible conditions. I saved lives, but I also lost people I cared about. When I retired, I was mentally and emotionally exhausted." Henry explained that his choice to work as a hospital attendant wasn't a step down. It was a conscious decision to remain in healthcare while reducing the pressure of direct medical responsibility. "I wanted to help people heal, but I didn't want to carry the weight of making critical medical decisions anymore. This job lets me contribute to patient care without bearing ultimate responsibility for outcomes. But your knowledge is too valuable to waste on cleaning floors. Is it wasted?" "Tonight, I helped guide a young surgeon through a complex case. Over the years, I've provided informal assistance to dozens of medical staff. I comfort frightened patients, help families understand what's happening, and use my experience to support the people who are carrying that heavy responsibility now." Sarah began to understand Henry's perspective. "You're still practicing medicine, just differently." "In a way, yes. The healing that happens in hospitals isn't just about surgical procedures and medications. Sometimes it's about presence, experience, and knowing when to offer help." Sarah's curiosity about Henry's military experience led to more detailed conversations. Over the following weeks, during quiet moments in the break room or while walking hospital corridors, Henry shared stories that gave Sarah insight into a world she'd never imagined. "My first deployment was Vietnam, 1981. I was 19 years old. Thought I knew everything about medicine because I'd completed corpsman training. First firefight, first casualties, I realized I didn't know anything." Henry described the reality of battlefield medicine, treating multiple casualties simultaneously, performing procedures under fire, making triage decisions that determined who lived and who died. In civilian medicine, you have time to think, resources to use, colleagues to consult. In combat, you often have minutes to save someone's life with whatever supplies you can carry. How do you handle that kind of pressure? You learn to compartmentalize. Focus on what you can control, accept what you can't. Make the best decision you can with available information, then move to the next patient. Henry's description of military medical training impressed Sarah. Corpsmen learned not just basic medical procedures, but also psychology, leadership, and decision-making under extreme stress. We were trained to function as independent medical practitioners in situations where no other medical personnel were available. That meant learning skills that civilian medics don't typically need, such as field surgery, advanced trauma care, psychiatric crisis intervention, even some dental work. When you're the only medical person available to a Marine unit, you become whatever kind of medic they need. Sarah realized that Henry's military experience had provided him with a breadth of medical knowledge that most civilian medical professionals never developed. As word quietly spread among the medical staff about Henry's background, young doctors and nurses began seeking his informal guidance. Henry was careful never to overstep his role or provide direct medical advice, but his experience proved invaluable for teaching practical skills and clinical thinking. Dr. Rodriguez, can I show you something? Henry asked one evening as a new resident struggled with a difficult foreign insertion on an elderly patient. Please, I could use help. Henry demonstrated a technique he'd learned in military medicine. Sometimes with older patients, the standard approach doesn't work. Try this angle and use a slightly different pressure. In the field, we couldn't afford to miss IVS. The technique worked perfectly. Where did you learn that? 22 years of starting IVS in less than ideal conditions. You develop alternative methods when standard procedures don't work. These informal teaching moments became common. Henry shared techniques for calming agitated patients, managing supplies efficiently, and working effectively under pressure. The most important thing I learned in military medicine, Henry told a group of new nurses, is that technical skill is only part of healthcare. The rest is about presence, patience, and understanding that healing involves more than medical procedures. 6 months after Sarah's first surgery with Henry, St. Mary's faced its most challenging night in years. A building collapse in a nearby neighborhood brought dozens of casualties to the emergency department, overwhelming the hospital's capacity. Sarah found herself leading one of the trauma teams, managing multiple critical patients simultaneously. The attending physicians were scattered among other cases, leaving the residents to handle more responsibility than usual. Dr. Chen, we need you in Trauma Bay 3, a nurse called multiple crush injuries, possible internal bleeding. As Sarah entered the trauma bay, she saw Henry already there, efficiently organizing supplies and preparing equipment with the kind of systematic approach she'd come to associate with his military background. What do we have? Sarah asked the paramedics. Construction worker, caught in the building collapse. Crush injuries to lower torso, possible pelvic fractures, definite internal bleeding. Sarah began her assessment, but the complexity of the injuries quickly became apparent. Multiple trauma cases required systematic prioritization and resource management skills she was still developing. Dr. Chen, Henry said quietly, would it help if I shared some thoughts about managing multiple trauma priorities? Sarah looked around the chaotic trauma bay. Yes, please. In mass casualty situations, organization saves lives. Assess systematically, prioritize based on severity and probability of success, and don't let the chaos distract you from the fundamentals. Henry's guidance helped Sarah organize her approach to the multiple casualties. His experience with battlefield triage provided a framework for managing resources and making difficult decisions about treatment priorities. This patient needs immediate surgery, Sarah determined after completing her assessments, but availability is limited. Sometimes in mass casualty situations, you have to make hard choices about resource allocation, Henry said. Focus on where you can do the most good with available resources. The building collapse patient required immediate surgery for internal bleeding, but all attending surgeons were occupied with other critical cases. Sarah found herself performing complex trauma surgery with only Henry's guidance and her own training. Remember, in trauma surgery, stopping bleeding is more important than perfect technique, Henry advised as Sarah opened the patient's abdomen. Focus on hemorrhage control first, then worry about optimal repair. The surgery was complicated by multiple injury sites and limited blood supply. Sarah had to make rapid decisions about priorities while managing ongoing bleeding from several sources. Dr. Chen, check the liver edge, Henry suggested. With this injury pattern, you might have a small laceration that's contributing to blood loss. Henry's suggestions proved accurate repeatedly throughout the surgery. His experience with trauma cases provided insights that Sarah's medical school training hadn't covered. How do you know where to look for these secondary injuries? Sarah asked during a brief pause. Pattern recognition. After treating hundreds of trauma cases, you learn that certain types of accidents create predictable injury patterns. The key is knowing what to look for. The surgery lasted for hours, but they successfully stabilized the patient. As Sarah completed her postoperative notes, she realized that Henry's guidance had been essential to the successful outcome. Henry, I couldn't have managed that case without your help. Your knowledge of trauma surgery is extraordinary. Dr. Chen, you performed that surgery. I just shared some experience. The skill and judgment were yours. Word of Henry's assistance during the building collapse emergency reached the hospital administration. Dr. Michael Torres, St. Mary's chief of surgery, requested a meeting with Henry and Sarah to discuss what had happened. I understand you provided valuable assistance during the mass casualty event. Dr. Torres said, several staff members mentioned your contributions to patient care. Henry shifted uncomfortably. I was just helping where I could. Dr. Torres, Mr. Washington, I've reviewed your employment file. It lists you as a hospital attendant with no formal medical training, but multiple physicians reported that you provided sophisticated medical guidance during critical procedures. Sarah spoke up. Dr. Torres, Henry is a retired Navy corpsman with 22 years of military medical experience. His knowledge of trauma medicine is extensive. Dr. Torres was surprised. Why wasn't this information in your employment file? Because I applied for a custodial position, Henry replied. My military medical experience wasn't relevant to cleaning floors and restocking supplies, but it's clearly relevant to patient care. Mr. Washington, would you be interested in transitioning to a role that makes better use of your medical background? Henry considered the offer carefully. What kind of role? We could use someone with your experience in our trauma department, not as a physician, but as a medical technician or trauma coordinator. Your knowledge could benefit patient care while allowing you to work within an appropriate scope of practice. After several weeks of consideration, Henry agreed to transition to a new position as a trauma team coordinator. The role allowed him to use his medical knowledge while avoiding the direct responsibility of making critical medical decisions. Henry's new duties included organizing trauma responses, training medical staff in emergency procedures, and providing support during complex cases. His military experience proved invaluable for improving the hospital's emergency response protocols. Mr. Washington, can you review our mass casualty procedures? Dr. Torres asked during their first official meeting. I suspect your military experience could help us improve our response protocols. Henry's analysis of the hospital's emergency procedures revealed several areas for improvement. His recommendations based on military medical experience enhanced the facility's ability to handle large-scale emergencies. In military medicine, we plan for the worst-case scenario. Henry explained to the medical staff. That preparation makes routine cases easier to manage. The trauma department's performance improved significantly with Henry's involvement. Response times decreased, resource utilization became more efficient, and patient outcomes improved. It's remarkable how much difference experience makes, Sarah told Henry one evening. You've transformed how we approach trauma cases. I haven't changed anything fundamental, Henry replied. I've just shared some systematic approaches that I learned in different circumstances. Henry's success in the trauma coordinator role led to requests for him to develop training programs for medical staff. His ability to teach practical skills and clinical thinking proved as valuable as his medical knowledge. Teaching medicine in civilian hospitals is different from training military medics. Henry explained to Dr. Torres, military training emphasizes rapid decision-making under pressure. Civilian training focuses more on deliberative analysis and consultation. Can you adapt military training methods for civilian use? Some aspects, yes. The systematic approach to problem-solving, the emphasis on practical skills, and the focus on maintaining performance under stress all translate well to civilian medicine. Henry developed training programs that combined military medical experience with civilian healthcare practices. The programs proved popular with medical staff and improved patient care outcomes. Dr. Chen, what's different about Mr. Washington's training? Dr. Torres asked Sarah after she completed one of Henry's programs. He teaches you to think systematically under pressure. Sarah replied, instead of just learning procedures, you learn how to adapt when procedures don't work perfectly. Henry's training programs became a model for other hospitals. His unique combination of extensive field experience and civilian healthcare understanding proved valuable for medical education. Sarah became one of Henry's most dedicated students, learning not just medical techniques but also the mindset that had sustained him through decades of challenging medical situations. Henry, how do you handle the emotional stress of medical work? Losing patients, making difficult decisions, dealing with traumatic cases. Dr. Chen, the hardest lesson I learned in military medicine was that you can't save everyone. Your job is to do your best with available resources, learn from every case, and keep going. But how do you live with the losses? You honor them by becoming better. Every patient you lose teaches you something that might save the next patient. The goal isn't perfection, it's continuous improvement. Henry's mentorship helped Sarah develop the emotional resilience necessary for a surgical career. His perspective, shaped by military experience, provided guidance that traditional medical training didn't offer. In military medicine, we learned that healing involves more than technical procedures. Henry told her, sometimes the most important thing you can do is be present with people during their worst moments. 5 years after their first surgery together, Sarah had become an attending surgeon and Henry had established himself as one of the most respected medical educators in the hospital system. Their professional relationship had evolved into a deep friendship based on shared commitment to patient care. Dr. Chen, I have a proposal, Henry said during one of their regular coffee meetings. I'd like to establish a program that helps military medics transition to civilian healthcare careers. That's a great idea. Many veterans have medical skills that could benefit civilian healthcare. The challenge is that military medical experience doesn't always translate directly to civilian credentials. Veterans often end up in non-medical jobs despite having extensive healthcare training. Henry's proposal led to a partnership between St. Mary's and local veteran organizations to create pathways for military medics to enter civilian healthcare careers. The program provided educational support, certification assistance, and mentorship for veteran healthcare workers. This program could help address the healthcare worker shortage while utilizing valuable experience that veterans already have. Dr. Torres noted when reviewing the proposal. The Veteran Transition Program became highly successful, helping dozens of former military medics establish civilian healthcare careers. Henry's model of adapting military experience to civilian healthcare needs proved replicable across different specialties. As Henry approached retirement age, he reflected on his unexpected journey from hospital custodian to medical educator and veteran advocate. I thought my medical career ended when I left the military, Henry told Sarah during one of their conversations, but working here has been just as meaningful as anything I did in the Navy. You've had a huge impact on patient care and medical education. How many lives have you influenced through your teaching and mentorship? I've never thought about it that way. I just tried to use my experience to help wherever I could. Henry's influence extended far beyond the immediate patients he'd helped treat. His teaching programs had trained hundreds of medical professionals. His veteran transition program had helped dozens of former military medics establish civilian careers. And his mentorship had shaped the careers of numerous young doctors and nurses. What's the most important thing you've learned from your transition to civilian healthcare? Sarah asked. That healing happens in many different ways. In the military, I focused on immediate medical intervention, stopping bleeding, treating wounds, getting people back to safety. In civilian healthcare, I've learned that healing also involves comfort, education, support, and helping people understand their experiences. Even in retirement, Henry continued his involvement with veteran healthcare issues and medical education. His unique perspective on the intersection of military and civilian medicine remained valuable for addressing healthcare challenges, the skills that military medics develop working under pressure, adapting to changing situations, making critical decisions with limited resources. These are exactly the skills that civilian healthcare needs, Henry explained to a group of hospital administrators. Henry's model of leveraging military medical experience for civilian healthcare benefit influenced policy discussions about veteran employment and healthcare workforce development. Mr. Washington has demonstrated that military medical experience can be successfully adapted to civilian healthcare needs, Dr. Torres wrote in a professional journal article. His approach provides a template for utilizing veteran expertise to address healthcare challenges. Sarah, now a department chief herself, continued to apply the lessons she'd learned from Henry in her own teaching and patient care. Everything I know about staying calm under pressure, thinking systematically during emergencies, and maintaining perspective during difficult cases, I learned from Henry, Sarah told her own mentor.